Good evening, everyone. Thank you for joining us. I'm Dean McElwain, the President and Chief Operating Officer of Castle Connolly Private Health Partners. Thanks for taking the time to join us and learn a little bit more about how our concierge physician partners have survived and thrived during the pandemic and used their creativity and all of their accumulated expertise to not only continue to provide great service to their patient members, but to innovate and to go the extra mile. So without further ado, I'd like to introduce a couple of our physicians who are joining us this evening. We've got Dr. Jeffrey Graff and Dr. Bernard Shays, both from the Upper East Side of New York City, Manhattan. And why don't we start with Dr. Shays? You can tell us a little bit about yourself and give the listeners, viewers, a little bit of background. And then after that, Dr. Graff, you can do the same. So Bernard.
Thank you. So my name is Bernie Shays. I've been an internist for about 35, 40 years on the Upper East Side of Manhattan. I joined Castle Connolly about 5, 6 years ago. I have a very nice panel. Most of the patients were my own, so we transitioned them over as I joined. I have a real practice, a very nice office. The COVID epidemic changed the way I practice, obviously, and I become teledoc. I bought a computer. I'm working from home. Today was a very busy day. I think I had about 38 visits. Some people like video, a lot don't, so we just chat on the phone. But with the EHR, I have all their records, and I have access to everything. So it's been a tough time. This epidemic has been very, very difficult. And unfortunately, I did lose some patients, which is a tragedy. But, you know, I think things are calming down right now, especially in New York. And I'm providing care, you know, through telemedicine. I plan to reopen my office in about 2 weeks, but it's going to be totally different. There will not be a waiting room anymore. Patients will come in, they'll go straight to the exam room, I'll do what I have to do, and they'll be out within 8 to 10 minutes. I think the days of the waiting room are over. I used to be very busy in the office, seeing as many as 10, 20 patients a day. Before the concierge practice, I used to see 30 patients a day, sometimes even 40. I like this model very much. I've been with it for many years. Patients are very, very appreciative. We're like one big family. They're free to call me. I give everybody my cell number. It's never abused. The way I work now, the patients will call my office number. My secretaries are home. They will make appointments, and then I will call the patient during the day. So all in all, the concierge model really, really works. I'm very pleased with it, and the patients are very pleased with it. As an anecdote, I had a patient join who's never met me. They heard about it. They heard about the model. They called up. I'd like to join. Joined, and now they're a patient. We've had 2 visits on the computer. So I think from all points of view, it's been very, very rewarding. And as a physician, you have the time to take care of the patients. You really don't have a huge volume. So I've been very pleased with this model, and it's evolving. And I think the future is very bright for concierge care. And,
Dr. Graff, I'm sorry, Bernie, if you might tell us a little bit about yourself.
Sure.
Well.
I'm Jeffrey Graff, and I've been in practice solo since 1986. And I've enjoyed it very much. And I think I went into the practice of medicine for the same reason that Dr. Shays did, that we really wanted to take care of people, get to know them, have long-term relationships. I have some patients, I'm sure the same is true of Dr. Shays, 25, 30 years. Of course, there are new ones that come. I was, before the concierge era, I was in an office, and I participated in insurances, as I still do. and I was seeing more and more patients, and every physician is familiar with what has happened in the practice of medicine over so many years. About 8 or 9 years ago, when Concierge was new in New York, I had an association for a number of years with a different company, and I let the 5-year period run out and did not renew, and took my time knowing that this was clearly the future of practice, because there was no way that I was going to be able to survive participating in insurance and being in my own practice in Manhattan. And so I was very fortunate in finding the Castle Connolly or Private Health Partners, and I've been with them for a few years. Initially, I had a model, a hybrid model, where some of my patients, this is before Castle Connolly could be in it, and some didn't join. But now, if somebody wants to see me for internal medicine, I really want to take the time to that's really indicated and important for patients, to see them as a whole person. So if you want to see me as an internist, you need to be in the program. I also am a cardiologist, so I have some patients that come and see me just for cardiology reasons. But I've enjoyed the concierge experience immensely. And I know we'll talk more about this, but during the last 2.5 months or so, it has saved me, we'll say, and enabled me to continue in practice in the way that I so much enjoy, and know that the future is something that is there for me. Which is really an amazing thing. Whoever would have thought that something like this would happen? And that's not the reason that I did it. I did it because there are so many benefits of the model. And for reasons that we'll talk about, the association that I have with Castle Connolly is really unbelievable, and it's great. So
thank you very much. Thank you so much. We appreciate that. And back to you, Dr. Shays. You know, as you could tell by the introduction and Dr. Shays reflecting on his panel and the volume that he has a bit of a hybrid practice, which we support. And more often than not, we migrate folks, if they're starting out as a hybrid, towards a fuller concierge to full concierge panel, as we've done with Dr. Graff, per se. It's important to kind of reflect, I think, as you've already started to do, about the difference, you know, kind of that you've experienced over the last few months in your ability to really maintain a form of practice, both, you know, from a practical standpoint and from the ability to manage your members who you have a relationship with. So I want to have you touch base on that notion of the importance of that relationship with your patients and how the concierge model has facilitated that in your experience, Dr. Shays.
So, you know, in simple terms, it takes the insurance company out of the patient care. I mean, you know, I do what the patients need. So, you know, before COVID, when patients came in, I ordered whatever appropriate tests I thought were needed. I didn't care about the reimbursement. I just did the right thing. I'm a big believer in prevention, cholesterol, A1C, hypertension, the usual stuff. The average A1C in my practice is 6.1, and I'm very proud of that. And part of that is I have the time. So, you know, if someone's not taking care of their sugar, well, I can spend half an hour discussing it, give different options. I track everything. I'm a bit of a nerd with a data set. So, you know, the concierge model, and especially Castle Connolly, I think the difference between Castle Connolly and other companies, at least in my experiences, they let you be the doctor. They've never once in 6 years, I think I've been with them, have ever interfered in patient care. And I really appreciate that. You know, that says a lot about the company. So, you know, you get to do what is right. There's no, the insurance company, you know, saying no, like if I need to call somebody 3 times a day to check on them, that they're okay, I do it. I could care less about the insurance reimbursement. And as Dr. Graff put it, and I couldn't agree more, during this pandemic, my office is closed. I'm stuck far away, so there's no income coming in. The only income really is from the Concierge and the Castle Connolly Health Partners. The check is always there. The accounting is very clear, and I really appreciate that. That's a big thing that I don't think is in every other company who's in this field. So I've been very pleased with my choice with Castle Connolly. So, you know, and I also look forward to the future. I think it's a great model. I think we deliver much better care. I think if you look at outcomes of people who are in a concierge model, they do very well. They do very, very well, staying out of the hospital, prevention, all the things we need to do. So it's a very good model.
Dr. Graff, would you comment on the same, how it's changed? You know, I've been up close to what's been happening in your practice in terms of adapting to telemedicine in a more profound way. You were doing it before, but it's become sort of the full delivery model. And then, you know, even as a cardiologist, to some extent, thinking about how you've been managing your patients. So I'd like you to comment on that, kind of living in the concierge model through the last few weeks and months, if you would.
Sure. Before this all started, things were very good. I could see a much reduced number of patients than I had been doing before the concierge model. And the nice thing is that there's plenty of time for patients, as opposed to running this room, that room, so on and so forth. It's kind of a luxury that it's really ideal. So things were going along very smoothly, and I had a set schedule during the day, and everything was hunky-dory until suddenly the world changed, and everybody had to scramble in their own way, patients, doctors, the rest of the world, to try and make the best of it. And the people who are members of the concierge panel, the patients are very interested in a number of things. Obviously, they're interested in their own health and well-being, and are paying attention to things in, I believe, a greater detail than many are. But they're also interested in me. And so these are people mostly that I know for years. There are some newer members, of course. A couple that I got during the 2-month period that I haven't met in person yet, but I did a telemedicine visit with. But people were also very concerned about how I was handling it. So I became adept with some help from the Castle Connolly people to how to do telemedicine. I also did emails a lot more with people. They were telephone calls all day long, all sets of new codes to bill and to learn. Then there was the PPP stress. But the one thing that was nice during all of this is that I felt that the people at Castle Connolly had my back. And one important story that I want to tell, which was really above and beyond, I spoke with the dean early on saying, oh boy, what am I going to do? I have no patients, I have no income, so on and so forth. Well, he came up with something that helped me a lot, and I'm sure other people now had to do with remote patient monitoring. And as a cardiologist, it's very important for me to be able to monitor people's blood pressures when I'm not in the office. And sure, they have their own units and they can do their own, but this enabled me to really see on my own computer screen all the data. I could have phone calls through this app. It was really very, very helpful and took a lot of pressure off me. There were a million prescriptions. As a matter of fact, for the last 2 months, the days were much more stressful than my usual days, just because of the volume of everything that had to get done. And it's all timely in medicine. So it was pretty stressful. We just, for whatever reason, I decided that I was going to start up yesterday back in the office. I had a huge volume of 2 people. I worked as if I would be working for NASA, about to go on a moon launch. But it was a whole new experience, and it will be, like Dr. Shea said, practice will be different than we're used to. I try and patients go right back, and we take the temperature and ask all kinds of screening questions, and but everybody understands, and we'll make the best of it.
Yeah, I think it's, as part of one of the things that we've been doing, which both of you have joined us on a number of occasions. We've been having our weekly, all doctor check-in calls during the pandemic to make sure that folks have everything that we could possibly provide them with in terms of information, the latest thinking on whatever treatments are out there, about testing, as much information as we could find on testing availability, including the antigen testing and immunology testing, and also then these return to office protocols, providing the information and the content around that. And I think additionally, one other component that's been evolving, and depending on which day you look at it, has been the billing around telemedicine. So in the early stages of this, they were paying for portions of it, and then it kept evolving and kept changing. And on a weekly or even more frequently basis, we were providing updates to all of our providers to how to handle that and how to evolve their approach to billing in the office. To Dr. Graf's point, you go from having your clinical revenue, and you have, it's like any other business, you have your concierge revenue, and that comes in at a certain cadence. And then you also have your clinical revenue, and you have your overhead, which doesn't stop. So when you build out your budget for the year and your business plan, you have to maintain that cadence of income. So we really had to help, change that shift from the traditional clinical revenue source to the telemedicine capability, which quickly evolved because the numerous payers adopted different policies. But we were able to not be flat-footed about that and help make that a reality. How that payment is coming through, we're still looking at that. Some of them have been a little flat-footed on the payer side to get the monies through the door, but nonetheless, we're told that that's going to be evolving over time. So, that gives us a real sense of, just kind of that transition from the in-office to, telemedicine-oriented approach, and now coming back out. Dr. Shays is coming back out and making plans. We were talking before the call about the acquisition of PPE, and we're all working collaboratively to make sure that we have everything available for the practices, so that we can have those spacesuit approaches that Dr. Graf was talking about readily available, and all the protocols are well in hand. Over the evolution of this, obviously, you've seen how your patients' needs changed, and obviously a lot of anxiety, a lot of concern, particularly we're talking with two epicenter physicians that were dealing with the onslaught of this, and that great anxiety and uncertainty by their patients. Dr. Shays, give us an idea, as a concierge approach, how you were able to kind of deal with your patients. And maybe if you could key in on the fact that, going back to what you said earlier, your patients. So they're generally, very well, their other conditions, their other concerns, their normal status, their normal, behavioral characteristics, if you will. So if you could kind of just tie that together briefly, that would be great in terms of how you approached it.
So like Dr. Graf mentioned, I guess the large majority of my patients have been with me for 15 to 30 years. So I know their families, I know their children, I know everything about them. And I do think mental health issues, unfortunately, are at the forefront of what I've been doing. So if I have a concierge member who's really having a tough time with anxiety, insomnia, depression, marital issues, I book them a, hour appointment with a spouse or not, child or not, and I'll spend the time with them. Basically, people want to be heard. They want to be heard about their anxiety, about their jobs, about, people want to be listened to. One of the great things about the Castle Connolly Health Partners is I can do that. Whatever a patient needs, I don't feel constrained by a time restraint. I don't need to spend 2 minutes on to the next patient, which is very ungratifying, I think, for all physicians. But this model really allows me to determine how much time the patient needs. And, it really impressed me, especially in the early days. Everybody asked me, how are you? How's your family? How are your kids? How are your grandkids? I mean, they all know my grandkids. They, they play in my office. So it's really, it's a business, and it has to be a business, of course. But I think the Castle Connolly Health Partners model allows it to be like one big family. Not everybody fits perfectly, but most people do. And it's very rewarding. I'm going to share just one more thing and then I'll stop talking. I had my secretaries, when we caught up after about a month, call every single member and say, how you doing? Do you want to speak to the doctor? He's available. Here's the time, he'll call you. And I think that created a great sense of relief. And patients were extremely happy to hear from us that we were okay, that we were concerned about them. And it was just a phone call. But that's the liberty that Castle Connolly Health Partners lets you do.
Yeah. I think if, we've, because, in our team, we've been involved in all of the communications with the members, in addition to what you're doing with your offices, for both offices. We've been able to really provide very frequent updates. I think we, on a cadence of maybe every other week, there's been a communication going out, that incremental, here's what's going on, here's what we're doing, I'm here for you, letting the patients know all of the updated information. We have behavioral health resources that are part of our program, so they're able to have access to that. And also to know that, all of our other resources remain available from a health coaching standpoint. We've done a bunch of wellness-oriented webinars through our SENS programming. We've had stress management. We've had exercise programs. We've even had some cooking classes and just ways for members to stay connected. And additionally also just to stay connected with their health coach, which has been very beneficial. The kudos and accolades that we've received from members regarding the health coaching team and their support during this time has really been, again, it comes back to, I think, the differentiating notion, and it was part of the mission when John and I started this, and hopefully you guys resonate. I think you have already. We wanted to make this personal. We didn't want it to be cookie cutter number one. We wanted to make sure that it is, in fact, a scalable big family, that we can have that personalized touch that's effectuated by each doctor with their own special approach, and that all we do is amplify that we just make sure that we understand each of our docs that we partner with to the best of our knowledge and not get in their way, really just to be an amplification resource and to make sure that when they need something, to the extent that we have the ability to provide it, that we do our very best to do it and create that essence of a connected family. And I'll touch on one more point about that. We've had a couple of our doctors do some volunteering on the front lines, being right in the COVID wards, and for both docs that are on this call with us, they've also been involved in supporting. They've been involved in remote monitoring. They've also been involved in supporting those docs who are going in the front line and cross-covering members for them, which is, again, that's the whole notion of community, family, that support where folks are watching out for one another. So it's really great to see. Dr. Graff, maybe you can talk a little bit about how you've stayed connected from that perspective and your approach, and having that concierge relationship with your patients, just being able to communicate with them, in that regard.
These have been, as everybody knows, amazingly stressful times for everybody. I have patients who were calling me 2-3 times a day, their husbands, their cousins, this person was sick, they were in the hospital, they had friends who passed away. And it was nice that they were able to reach me. They were happy about that, and I was also very fortunate in order to be able to do this. The communication with members, patient members, is something that is so important. And the thing that everybody who's watching this should know, that it was so reassuring for me that I could just either call or write an email and say, I'd like to send an email to the patients, and these are the things that I'd like to say, and then if there are other things that you can add. And it happened within 24 hours. It was done. It was great. I know that members read them and read them carefully because they replied and they said, oh, we're so happy to know this, or thank you for sending us. So in the last 2 months, I sent out, with help, of course, 4 emails, the last one announcing that we're starting again and some of the new protocols. The level of support at Castle Connolly, and I'm in a position where I can really make a valid comparison, is so high that I can see myself staying with them for years and years. People are interested. I can do my own thing. Nobody says you better do it this way, you have to do it that way. I've been doing this a long time. Like Dr. Shays, we know what works. Castle Connolly is there to support us in a myriad of ways that we both and the other doctors so much appreciate at a very high professional and yet personal level that it's so reassuring.
Yeah, well, then we're on our way to our mission then. So that's been the goal from day one, is to make sure that we, you partner with the best physicians, you listen to what they're telling you, and then it makes it better for everybody, and we try to, really focus on delivering what we promise, and make sure that we're, focused on our ability to help communicate with the members, support the members, make sure that you have everything you need in terms of dealing with them on a day-to-day basis. And what the most about your business when it's under a tremendous amount of stress. And I think we've all seen, and I think that's one of the primary objectives for tonight's webinar, is to say, this model has been pressure tested. Our model in particular has been pressure tested. And what we've seen from what we've seen from our perch is that, and this is time and time again, every conversation I have with all of our physician partners across the country, is that if they had to be operating under normal circumstances outside of the concierge model right now, their practices would be closed. The telehealth, telemedicine, billing, and the financial viability of that as a singular approach makes it completely unsustainable. We've decompressed that worry that singular reliance on reimbursement has completely changed in our model. And because of that, you have the ability to, in fact, just focus on the patients and just make sure that you are a resource for them. We're decompressing the rest of the systems. I think importantly, I'd also like to comment on the fact that we've seen in the press some of these very high dollar, very high cost concierge programs, $10,000 a month, and people charging exorbitant rates for testing. Come by and I'll charge you $2,000 for a test, and show up at my office, or we'll send someone out to your house in the Hamptons to be tested with the special delivery. We in our community of concierge physicians and members, we deal with regular folk. We deal in a very direct way with folks who, because of our membership rates and the connectivity we have in the communities that we are in, it's very accessible. And as I frequently say, for the really what you would spend on a cup of coffee a day, you're getting access to a top doctor. And that's really what the price is at the end of the day. So, it's been exciting to see how we've created this sustainable model that I think contributes to the greater good in so many ways. You're keeping people out of the hospitals. You're keeping them, importantly, out of dangerous areas, particularly at this point in time, and you're allowing them to make good decisions collaboratively. So, kind of going forward, what do you think, how do you think your practice will change? Dr. Shays, if you want to comment on that moving forward, your perspective on how you might change your approach based on what you've experienced, if at all, by the way. I'm mixed on my, the debate around, are we all going to adopt fully into telemedicine more aggressively or not? There's a lot to be said for that personalized one-on-one. There's a role for telemedicine, certainly, but there's a lot to be said for the engagement, So if you want to comment on that, your experience, probably have telemedicine burnout by now.
Well, the problem with engagement, I think, until it's safe, and I do mean safe, I think we better be very careful. I mean, the American Psychiatric Association and the American Psychological Association has not allowed psychotherapy one-on-one yet. So I think we have to go slow. It's not my choice. I would love to, be back in the office, touching people, using my stethoscope. We have to put safety first. And if that entails a moon suit when you're in the room with a patient, you have to do it. And, part of the best practices that I've learned from my colleagues who were with the COVID patients, don't spend more than 8 minutes with a patient, face to face. If they're spewing the virus and you're getting, 8 minutes worth of virus, you're going to get a low dose. Hopefully you'll make it. If you're spending half an hour with the patient and you're getting an amplified viral load, you're going to be in trouble. Now, again, who knows? This is still evolving. Best practices, best safety practices are still evolving. So I think the concierge model lets us be flexible. If it's telemedicine, it's telemedicine. I don't mind. I have a long history with the patient. I think it's pretty effective. So I really don't mind doing it until it's safe. But I think safety first. We cannot risk our patients, our staff, or ourselves. So for the time being, I think we just have to do the best we can under the circumstances.
What do you think, Jeff? What's your perspective on kind of moving forward?
I wanted to just say one important thing that, and then I'll address this. While the 2-month period, 2.5 months was going on, patients who had been seeing physicians in the hospitals, and there are plenty of big teaching hospitals, all the offices of all the doctors, their gastroenterologists, neurologists, all the specialists, anybody, closed. They could not reach any of them, nobody. And they complained to me about that, and I told them that I wish that I could help them, but if I didn't have that particular doctor's cell phone number to text them or to call them, I wouldn't be able to reach them either. And there's nothing like old-fashioned medicine, and I was very happy that I was there for them, and they were very happy that they had somebody that they could reach. Okay, that being said, I think the future is, it's different. We talked about it. The waiting room is going to pretty much disappear. Telemedicine, I have said to my wife and my kids that I sat in this office for many hours a day. And I know that I did important things for people, but it isn't the same. You have to be with somebody. You need to touch them. You need to be with them. And I miss that. And that's why it's good. But safety first, I agree 100%. Telemedicine is here to stay. I will offer it to patients if they're uneasy about coming in, or if they prefer that for whatever reason. And of course, the phone calls and emails and all of that. But face-to-face, in person, the old-fashioned way is really so essential to taking care of people that we all long for it. Safety first, I agree.
Yeah, that's reflective of most of the conversations that I've had with all of our partner physicians across the country. There's elements that they really like and they want to keep. We've always had telemedicine as a component, of course, and the platform has always existed. Utilization is done, based on that sort of convenience factor. But you have varying degrees of adoption by physicians and more importantly, by the patients who are comfortable or not comfortable with it. So, I think we'll have some element of it, of course, going forward, and folks will be a little more comfortable, just as we may be a little more comfortable having meetings like we're having right now. So I think it'll be interesting to see how it evolves. Back to your earlier point about the specialists, what we've seen is absolutely true, is that, many of the specialists, if not the majority by far, have been shut down. But one of the strengths of our connectivity through the Castle Connolly family is, we have a network of about 56,000 specialists across the country. So we've had times where we've had to navigate and make those connections. And to Dr. Graf's point, knowing how to connect with them is critical. If you don't have that connective capability and a bit of the imprimatur of Castle Connolly woven in there. It's a different story. So it's I believe another strength that's been further amplified as we've moved through this. And I think want to just touch as we kind of wrap things up here, and we'll see what we have for questions from the viewers. I think if we can kind of touch on, as a final point, what have you, from the standpoint of just, your clinical approach and how it's changed, having gone through this, Dr. Shays, what have you feel like you've, and this is sort of a general, part of the discussion, clinically you've had to adapt to making decisions without all of probably your usual data. And if you can comment on that and just, the strength of the relationship and how that ties into it. These patients, they're concierge members that you can relate to very, very closely. You don't have all the data, but you might know their normal status. And I'm just interested to know how you've kind of, made that adaptation, if you will.
Well, Dr. Graff touched on something very important during the crisis. I don't know what happened to the communication skills of the hospital. I can understand they were overwhelmed, but
yeah.
a family member entered the hospital, they received no data. I mean, their family member could be in the ICU for 2-3 weeks, intubated, nobody would talk. So at the beginning, I spent most of my day, like you said, I have people's cell phone number and I know all the doctors, and I spend most of my day getting information for family. And I think that was critical. I mean, how horrendous to have a family member in the hospital for 2 weeks and nobody called you, nobody's returned a call. And I understand they were overwhelmed, but that was really a hard. So I think I was very happy to be able to help my patients navigate that. In terms of knowing my patients, again, it's a trust issue. The patient calls me, a lady called me, she's 82 years old. She knows when she gets her recurrent UTI, I don't need to see her urine. I don't need to see anything. I know what works for her. I know what doesn't work for her. It's a 30-second conversation. And that makes the practice of medicine really the art of medicine. And I really appreciate that. And without the Castle Connolly Health Partner model, I wouldn't know her so well. I know her living arrangement. I know her aide. I know her granddaughter who comes and sometimes doesn't come. So, it allows doctors and patients to bond in ways that traditional fee-for-service or capitation model does not allow. And for me, that's very rewarding. I could give you many examples of that, but it's the level of trust that patients have in us. And Dr. Graff and the other physicians, we really have the patient's trust. We trust them and they trust us. And that's key to providing good health care. Dean, you're
muted.
You're muted.
Oh, I'm so sorry. There we go. My apologies, everyone.
I'm not the only one with computer issues.
Yeah. I was actually searching the Q&A, so I think it automatically muted me. So, the powerful word that comes to mind, which I was saying while I was muted, is advocacy. It's the ability to have that, again, you're laser beam focused on the patient, the member, and you're acting as an advocate. And I don't know if you have any reflections like that, Jeff, as well, if you want to share.
The thing that I said in the very beginning, the very reason that we went into medicine as internists, I guess primary care, whatever you want to call us, is because we care. We like to do the right thing for people. We enjoy what we're doing. And it, as Dr. Shea said, it's so rewarding to have people that come and see you. They're like family. And you talk to them about so many different things. I really enjoy it. And it makes me feel like, I know that primary care doctors who work for hospitals and other big organizations, they come and they go, and patients are unhappy with that. We're here for them, and at both ends of the relationship is enjoyment and appreciation, and it's very rewarding. That's what being a doctor is. So.
Yeah, I wanted to open it up for questions, and I'm going to switch over and look and see what we have on the question board here in a second. See what's open sitting out there. Okay, all right. I'll make sure I'm not muted, right? So, one of the participants is asking, if you could kind of reflect for a minute on, how this has affected, your staff and how you've had to kind of work with them and continue to collaborate with them, and what kind of stress this has placed on them, and then how you feel, your ability to kind of bring them back in the office. There's some questions sitting out there about, what are your plans for bringing folks back into the office from a staff perspective? Bernie, do you have any thoughts on that?
Yeah, I'm blessed. I have the world's best staff. I'm sure every doctor feels that way, but I have a very good staff. They, from day one, forwarded all the calls to their cell phones at their house. I bought them computers. So they're able to do all the admin stuff from home. And I want to maintain that. I mean, my goal is when patients come in, I don't want them to go near the staff. They're going to go straight in the exam room. So the billing, the insurance, the co-pays, the prior auth, whatever it is going to be done remotely. So the patients will either do that ahead of time or after. In terms of having them come back, I want them back. I need them. I need the support. I think they kind of need it too. I am worried about them having to take public transportation to get to the office. So I'm trying to figure out to pay for Ubers. Is that safe? That's safer? I don't know. I'll probably stagger their hours so they won't have to, be there at 9 when the big rush is in the subway. So maybe I'll have one come early, one come late, days. I'm very cognizant of their safety and well-being. And my staff loves the concierge model. I mean, they're family. Patients reach out to them much more than to me. They need refills. They need, whatever they need. My staff is part of the family, and they're very happy with the Castle Connolly model. And, they realize that it's keeping us in business. As Dean mentioned, if we didn't have Castle Connolly Health Partners, and we'd have, who knows, 6 months of no patients, I couldn't pay their salaries. So I told them from day one, you never have to worry about your salary. You're going to be paid. I won't get paid, but you'll get paid. And they're very busy. I mean, they really work from 9 to 5, doing prescriptions, doing, the mirrored notes for the job. There's a lot of work. Surprisingly, I think it can be done from home. I think it can be done remotely. So that's a good thing. So,
well, make sure your staff's not watching this.
They know how I feel. I tell them we have a Zoom meeting every morning, so they know how.
Yeah, one of the participants is actually one of the docs that we're just starting to work with in New Jersey, was asking, how have you been handling, neither one of you can walk us through this, how have you been handling prior authorizations and those type of things? Same as you always would, right? You just get your team put together. Yeah.
In my office, all that stuff is seamless. I never have to get involved with it. I mean, I trust staff to know what they're doing, and they do. They've been with me again for, 10, 20 years. I mean, they're an autopilot. So it's a big part.
Yeah, I heard it described, if one of our partner docs used the phrase, I've converted my office to a telemedicine hub, and that's, it becomes a virtual, of course, office, but, all of that support for the members continues. Very easy to quickly adapt to that. And now as we come back out of it, we'll do it in appropriate ways. And any other final thoughts from you, Dr. Graff, that you want to add before we wrap things up?
Not really. I'll tell you, I didn't have many prior authorizations to do because I couldn't send patients for tests anywhere because everything was closed. And I dealt with medicine prescriptions. So and my staff, they were so happy when I told them that we were going to start back in the office. I couldn't believe it, you know? So that was very gratifying. And they're like family.
Yes.
So they're like family and they worked hard at home. And I also told them that they were safe, their jobs, and they were happy. And so it's working out.
That's great to hear. You know, I think hopefully the participants, the viewers can see that, you know, we have collectively created a model here that is sustainable, that's enduring, that has, you know, and most importantly, created a capability for the patient members to stay connected with their physicians, for those physicians to be in a situation where they can operate and remain viable and able to take care of their patients in many ways, just as they always have. And you can see that, you know, again, that sustainability, that durability is a key factor in the concierge model. So I want to thank everyone for joining us this evening. And thank you, Dr. Graff and Dr. Shays, for your participation. And we really appreciate every one of the viewers this evening that's joined us. So thank you so much. And we will look for extra questions after the fact, and we'll put some responses out on our social media pages as well. So thanks again for joining us, everyone.
Thank you.
Appreciate it. Thank you.
Take care of yourself.
Thanks a lot. Take care.
Bye-bye.